muted, all of us, except those who are going to be speaking. And to the speakers and the awardees, I would say, please keep your cameras on. And to those who would like to interact with us, please write your comments and questions in the chat box, and we'll come to you when the time comes for the question hour session, and let us not talk any time in between. And of course, there will be, you can raise your hands when we have the open window for discussion. So coming back to the Forum for Medical Ethics and the Indian Journal of Medical Ethics Awards. So I've been associated with the FMES and IJME since 2005. And since then, I've seen them actually helping the discourse on public health ethics, bioethics, medical ethics, research ethics, and I cannot think of a better entity for hosting these awards. And these awards are happening under the aegis of the 8th National Bioethics Conference, which was also hosted by the Center for Ethics, Yenepoya University, which is a deemed university. So now I invite first Dr. Sunita Bandewar here to tell us a little bit more about the awards. And so Dr. Sunita Bandewar, she's the Secretary General of the Forum for Medical Ethics Society, and generally the person who has been keeping all these events on track, and the background person to keep us all engaged. And so I'm very happy to invite her here. She's also she has a master's in bioethics from the University of Toronto, where she was also a senior research fellow. And she's also the core editorial team of the Indian Journal of Medical Ethics, and she heads the FMES newly established body, which is the Health Ethics and Law Institute, the HEAL Institute, very aptly named. So I invite Sunita to tell us a little bit more about the awards. Welcome, Sunita.
Thank you, Amita, for that introduction. And I'm going to really take 2 minutes to just briefly talk about FMES. The Forum for Medical Ethics Society is, in fact, in 2022, we are commemorating its 30th year. And it's really a sort of, it cannot be a better occasion to have the second round of Ethics Award. As Amita said, we do have 3 platforms, and these are Indian Journal of Medical Ethics, that is IJME, which was established in early 90s. National Bioethics Conference, once again, Amita made reference to, and which was established in 2005, and HEAL Institute, which was established in 2018. Just briefly about how we got, how it was got conceived, and a little bit about genesis. So it was indeed way back in mid and late 1980s when the malpractices within regulatory bodies such as Maharashtra Council of India, and also within healthcare settings facing issues such as misuse and abuse of the then available diagnostic, all of you would know, such as amniocentesis for sex identification, medical negligence, and many other issues which breach the very foundation of medical ethics. It brought a few practicing clinicians in Mumbai together, and they started with a very small little study circle for discussing these issues. And eventually they felt the need for sustained long-term intervention to recognize, to respond and redress these issues. And it is against this backdrop, a small study circle was quickly transformed into a registered entity, which we call now FMES. Its overall goal has been to strive towards improving quality of healthcare and research in health and allied areas which comply with ethics standards. We are a multidisciplinary entity, both in terms of its work as well as membership base. It serves as a bridge between academia and advocacy initiatives informed by grassroots players, and all of you are, in a way, those important players on the ground. Their work, and also it is informed by the broader people's health movement. Collaborative approach to our work is one of the features, and over time we have expanded our work beyond medical ethics to engage with issues in bioethics as much more broadly conceived. Just a little bit about Ethics Award. As you know, numerous individuals and organizations have, with their dedication and collective efforts over the years, made ethics as part of the public discourse on health practices, research, and policy in India. And we also witness malpractices, as many of we kind of crib about what goes wrong within those spaces. And at present, there are insufficient avenues to recognize and honor individuals for their contribution to healthcare ethics and bioethics in India. And that is the reason that FMES and IGME decided to institute a regular bioethics award that could encourage role models, and all of you belong to that space now as role models in the practice of ethics in healthcare. And before I close, I would like to mention that FMES, although aspire to institute such awards for since some time, it was possible due to Dr. Olinda Tim, and she's with us today, because of her interest and initiative to create ethics awards funds out of royalty, her own book in bioethics, published with the Elsevier publishing house, and the royalty it fetches. So we hope to sustain these important awards to recognize individuals and entities who uphold ethical practices and also uphold the professional integrity in your own spaces. Thank you, Amita, and I'm looking forward to listen to all the awardees and their acceptance speeches. Amita, back to you, please. Thank you.
Thank you, Sunita. I would now like to invite Dr. Vijay Gopichandran to tell us a little bit about the Indian Journal of Medical Ethics. As you know, this has been one of the major activities of the Forum for Medical Ethics, and also has created a strong scholarship in this relatively new area of work that it was 30 years back. Dr. Vijay Gopichandran is a working editor at the Indian Journal of Medical Ethics. He has an MBBS from the Madras Medical College, Chennai, and also a Doctor of Medicine in Community Health from Christian Medical College, Vellore. He has also worked with the Grassroots Rural Women's Social Education Center, which we know better as RUSEC, and he has pursued doctoral research in public health ethics at the SRM University. He was the Inspire Fellow from the Department of Science and Technology with Government of India. And his PhD was in a very relevant subject, that of trust in the doctor-patient relationship. He has a long association with the IGME, and I invite him to introduce the journal to us. You have 2 to 3 minutes to do that. I hope that is sufficient. Do come, Dr. Vijay.
Yeah, thank you, Amita. I would take this opportunity to introduce the Indian Journal of Medical Ethics. The Indian Journal of Medical Ethics is celebrating its 30th year of inception this year. And what initially started as a small newsletter where doctors came together to write about issues in medical ethics, slowly and organically transformed into a globally acclaimed, peer-reviewed medical ethics journal. And this journal carries important issues in areas of medical, clinical, public health, and bioethics. And the journal is completely open access, meaning there is no need to pay for accessing the articles in the journal. And there is no article processing fees from the authors. Those who are interested in writing need not pay any money for publishing in this journal. The journal works on the principle of volunteership. Everybody, starting from peer reviewers up to the journal editor, the chief editor, the journal model is volunteership, and it is available online for free download as PDFs. And the print issue is dispatched to those who are subscribing to the journal. The journal takes a very multidisciplinary approach to bioethics, and it draws from various disciplines. It draws from medicine, public health, nursing, allied health sciences, sociology, anthropology, economics, politics, history, philosophy, and several other disciplines. We have had scholars from all these disciplines writing, and scholars collaborating and writing in the journal. And it has center staged important ethical issues related to health systems, practice of medicine, public health, delivery of healthcare services at the grassroots level, matters of health inequities, and human rights. The journal has provided a very interesting platform for healthcare providers to voice their views, through their ethical case studies, through opinion pieces, through original research articles, commentaries, and debates and discussions. And the journal has also evolved the discourse on various important key issues that are contextual and relevant in that time. The journal has drawn from close engagement with the people's movement, various people movements like the women's movement, the human rights movement. They have all informed the way the journal has progressed, and it has served as the bridge between what happens in the community at the grassroots and in the academia, bridging these two spaces. The greatest pride of the journal is that it stands tall without succumbing to market pressures in the publication industry and runs through a completely volunteership and philanthropic model even today. And one of the initiatives of this journal is this, and FMES and this journal is this award. And it's an honor to be able to introduce the journal in this program. Thank you. Thank you, Amita. Over to you.
Thank you, Dr. Vijay. That was great. I would now like to invite Dr. Uma Kulkarni. She is a professor of ophthalmology at the Yenepoya University. And as you know, they have been hosting this year's 8th Bioethics Conference along with FMES and IJME. And I would really like to invite her to introduce us to the Center for Bioethics at the university. So she has a postgraduate diploma in bioethics and medical ethics, as well as another one in clinical ethics. And she has been a faculty with the Yenepoya University for over 17 years. And she has been spearheading research on bioethics at the university, and also together with the other core group members, keeping the scholarship on bioethics alive at the university. I welcome you, Dr. Uma Kulkarni, to talk about the Bioethics Center. You will have 2 minutes.
Yes. Thank you so much. I thank FMES, I thank IJME, and I thank Amita for inviting me here to introduce Center for Ethics in the next 2 minutes. The main aim of Center for Ethics has been to bring bioethics into the mainstream academics, healthcare, and research. So in 2011, Center for Ethics was established when Dr. Veena Vaswani came back to India after completing her MA in bioethics from the Erasmus Mundus program of Europe. This has got many, center has many firsts to its credit. The first ethics dedicated center in a medical college is the first to start a PG diploma in bioethics and medical ethics, which is running consistently for the last 12 consecutive years, is the first one to start a course in clinical ethics, and is the first one to receive a research ethics educational grant from the NIH USA in India. So we have international faculty, Norbert Paul, Bert Gordon, Bebeloff, Ruth Macklin, and Corina Porteri. And we have national faculty, Dr. Amar Jesani, Arun Bhatt, Mala Ramanathan, Anant Bhan, Nandini Kumar, Shamala Natraj, and Sandhya Srinivasan. And we are the in-house faculty, Dr. Veena Vaswani, Dr. Ravi Vaswani, Dr. Poonam Nayak, Dr. Grishma, Dr. Imad, Dr. Mudassir, and me. And this is about the courses that we run. PG Diploma, Bioethics and Medical Ethics has started in 2011. And we have more than 140 who have completed, and we are still continuing to enroll students every year, up to 25 every year. Since 2012, we are running a clinical ethics course, and we have completed, about 13 students have completed, both faculty and students. The highlight of our center is the intensive summer workshop in ethics and research, which we call ISWARE, and more than 250 participants have completed this course. From 2012 onwards, we have been running this program, and we are proud to say that so many students have participated in this program. We also run value-added courses in bioethics and environmental ethics, and also value-added course in clinical ethics and medical humanities for the undergraduate students of the Yenepoya University and also other universities. And 64 and 45 UG students have enrolled in this program and have successfully completed it. The highlight of Center for Ethics is the UFIC Master's Program in Research Ethics, MSc Research Ethics. This is funded by the NIH, Bethesda, USA. The educational grant supports the master's program for a period of 5 years, and it has been approved by the Health Ministry Screening Committee, Ministry of Health and Family Welfare, Government of India. 32 students have so far enrolled in this program and 18 have completed. We are proud to say this. And Ethics Committee Mentoring Program is one of the highlights of Center for Ethics and the NFOA Ethics Committee 1, where we mentor, train, and also help them get accredited to NABH and FERCAP. And we have conducted many such programs in various parts of South India and Karnataka. And we have many international collaborations, one of them being Johannes Gutenberg University, Germany, among the others. And as a part of this collaboration, we have had many student exchange programs. More than 50 students have been exchanged between Germany and India following this MOU. And we have many alumni who have been heads of various bioethics centers in various parts of India. We have many ethics committee members who have come out as alumni of Center for Ethics. We have members on the editorial board of IJME, and we have also many of us have now contributed to the Center for Ethics as faculty, as additional faculty, and many more. So this is the CFE logo, which was created by the undergraduate medical students from NFOA, depicting harmony, and this is what we're striving for, and much more to dream and achieve. And thanks from the desk of Center for Ethics. Have a good day, and many congratulations to the awardee. Thank you.
Thank you, Dr. Uma. And now we come to one of the most important sections of the evening, and that is the actual selection process of the awardees. As you know that awards are really important when their selection process is transparent, robust, and I'm happy to say that we had a very good selection committee. I'm going to introduce those who were on the selection committee shortly. And as you know, we had a number of applications, and they are going to talk to us how they actually went through with selecting the best ones, and tell us about the dilemmas they faced and how difficult it is when there have been a lot of people tirelessly working on the ground. And so our selection committee was made up of Dr. M. Prakashamma, Dr. Sulakshana Nandi, and Dr. Pavitra Mohan. And I'm going to introduce all three of them together and then call on them one by one to tell us a little bit about how they went through this process. Dr. Prakashamma is the Executive Director of the Academy for Nursing Studies and Women's Empowerment Research Studies, better known as ANSWERS in Hyderabad. But she is more well known for the entire leadership that she has given to the nursing students, faculty, the entire discipline of nursing, which was almost absent at the policy level at one time, at the policy and the research level. But she actually spearheaded the entire work from that perspective. And also she has been a scholar in public health and bringing all those issues on board, which have been neglected, especially the grassroots movement of Ashas, Anganwadi workers and nursing professionals, as well as those issues which have been peculiar to that profession. So I welcome Dr. Prakashamma. We also have Dr. Pavitra Mohan. He's the co-founder and the secretary of the Basic Health Services, Healthcare Services Program, and the director of the Health Services Department at the Ajivika Bureau in Udaipur. He's basically a pediatrician by discipline, and he's also earned a doctorate in medicine. He's also the doctor in medicine from University of Delhi, and also has a master's of public health from the University of North Carolina at Chapel Hill. He has been working with well-known institutions of public health such as Earth and also at UNICEF. In 2012, he founded the Basic Healthcare Services, a not-for-profit organization to promote models of high quality and low-cost primary healthcare services in underserved areas. And now he's also heading the health services portfolio at Ajivika Bureau. So with this rich grassroots experience, he was very well placed to be on the selection committee. And Dr. Sulakshana Nandi also similarly, she's the co-chair of the People's Health Movement Global on the steering council of that PHM. She is the state convener of the Public Health Resource Network in Chhattisgarh and also the national co-convener of the People's Health Movement in India. She supports community health organizations in Chhattisgarh state of India on working on right to food and right to health, and of course also on forest rights and gender and rights of the indigenous communities, bringing in the social determinants perspective and the lived realities of people on the ground. And she's also involved in research, capacity building, and advocacy on issues of health equity and access. So I would first like to invite Dr. Prakashamma to share a little bit about the process through which these awards came about. Dr. Prakashamma.
Thank you. Thank you very much. And warm welcome to all of you. And thanks both to Enepoya and FEMIS IJME for initiating this. Three of us had several meetings, discussions to help us go through this process and be objective as possible in selecting the awardees. And during this process, we are very much aware that total objectivity is not really it's very difficult for us. Each of us, we come with our own perspectives, our own value systems, and that colors sometimes even what we select, what points we take up for evaluation. My colleagues, Dr. Pavitra and Dr. Sulakshana, will be also raising some of the dilemmas we faced, the processes we used. So in the initial phase itself, we decided, since every one of the nominees, they had a lot of work, rich work, very important work which we couldn't do, which they have done at a time of crisis. And therefore, we needed some reference points to guide us in the selection. And being very aware that we have to be our own values, our perceptions, our own internal fears, from where we come, all this colors our decisions. Being aware of this, we thought, okay, let us select at least a few reference points. So we took both normative, norm reference points and criteria reference points, and using those as kind of guiding, and using the overall ethical practices as the fundamental point through which we start selection, because that was already given. And we said, let us try to use the data that we have to make the selection. For example, we took some criteria reference points, and those were, the first point was the humaneness of the activity conducted by the individual or the organization. Humaneness means kind of the emotion that is required. At that point, what is valuable, what is the most important for humans, for human beings, what affects them, and what relief was provided. You know, death, dying, grieving, humanness in terms of highly underprivileged groups or highly vulnerable groups, those who are already very sick, very old. You know, we looked at these as the humanness point. We looked also at the emergency service provided. At what point did they start? At what point in the context of the entire pandemic did this group or this individual work? And what type of extent that they covered, the extent in terms of geographical area, the groups that they helped, the beneficiaries, was it a large group? Was it like, you know, disabled groups or displaced groups? People going through great hardship. So we looked at this as one point. Then we looked at the continuity and impact. So these were some of the criteria and reference points that we used. Then we also said, let's look at some normative points. For example, is this the individuals or the organization's usual work? Did they move away from their norm and what they were already doing? How much did they move away, or did they start new? How much of a hardship did they themselves put in? Effort did they put in? How much did they go out of their way to render the service? Out of their way means, was it their regular duty? If regular duty, did they do something extraordinarily out of the regular duty? Did they themselves go through hardship while doing this duty? What personal hardship, what commitment was there? So, I mean, I don't want to go into much detail, but my colleagues will be telling other aspects of the selection process. But these were some of the criteria we used to guide us, so that we, keeping on board all our own perspectives, our own systems from where we come in, we would be guided in an ethical I won't say totally unbiased, because ultimately it is an individual that we select, someone who appeals, this person or this organization has done far beyond. So this is what we have used as our reference points to make a selection. And we discussed, there were a lot of dilemmas back and forth, and I'm sure my friends will be telling a little bit more about that. Thank you very much. Over to you.
Thank you so much. Dr. Pavitra Mohan.
Thanks, Amita, and thanks, Prakasama, for so eloquently speaking about the process that we followed. But also, I think I would start by saying that it was, after all the criteria that we thought of, it was an extremely difficult proposition, because what we saw was quite amazing. I think I'm absolutely feel privileged to be a part of the group, surely because the kind of, otherwise I would have missed on so many stories of such courage and such, dedication at the time when everybody was very fearful, right? I mean, it was a time when people were fearful. They really needed any straw to hang on to. There were such stories of desperation and misery. And within that, there were people, individuals and organizations that were out there, they were not fearful of their own lives and deaths and of their own family members, but they went absolutely out of the way to help those who really needed it. I mean, several stories, and you would hear them in the citation. But the fact that people were out there, they were trying their best, they were resilient, they were not bogged down by the situations. And there was there was very quick thinking and action that was required really at that point of time, because there was no time to be lost. The whole humaneness that Prakasama talked about, of really feeling connected to others, right? I mean, they were not only bothered about themselves, but they were, for example, there were stories of girls who'd been sexually assaulted, and there was complete lockdown. You could not go to the courts, and in such situations, really, when everything was closed, going out and assisting them in every which way that was possible, while maintaining the highest kind of ethical conduct. So all of it was really heartwarming. Despite the criteria, we did find it difficult, and thanks to the quiet presence of Sunita and the help of Sharanya and Mahendra, who would keep coming back silently to us and say that, do you want to take another look? And all of that really helped us, and also sending us all those printed long application formats of everyone, which we scanned through, discussed, again, slept over them, and finally came out with something which is really great. But also for those who did not make it to the top 6, I would say that there were all extremely valuable work and contribution people did, and therefore it was a difficult choice, but glad that we were able to converge on some that we could share today.
Thank you. Would you like to add to this, Sulakshana?
Yeah, thanks. I'll just echo what Dr. Pavitra and Dr. Prakasama said. I mean, I think I also really feel privileged that I was part of going through all these narratives and these stories. And I think one of the important things was also to, I mean, there's so much of discrimination happening, so much of stigma. And I think that was also, I mean, this whole aspect of humanity and, really trying to respond to and trying to sort of address the kind of stigma and discrimination in society, within, with communities. The work that the awardees have done, I think has it really, I think, put them apart from others, and just huge congratulations to the awardees, all of them. Yeah, thanks.
Thank you so much, and a big thank you to the 3 of you, because this was a really challenging task, and I got to know from everyone that the process was really robust. The discussions were really interesting. So a big thank you to all 3 of you. And then now we come to the main award presentation function and speeches by those who are awardees. And we also have our own family of FMES family and the IJME working editors to tell us more about those who have won the awards. So I'm going to briefly introduce those who are going to announce the awards. And the awardees in this session will be Paswati Muthurangam, Sanjana Chikhalkar, Jinya Chatterjee and Anish Mishra. And I'll just announce those who are going to be announcing these awards. And first is Professor Mala Ramnathan. She is the working editor with IJME, and she's also on the faculty of the Achyuta Menon Center for Health Science Studies and Sri Chitra Tirunal Institute of Medical Sciences and Technology for quite some years, since 1996 actually. She has a PhD in population sciences from IIPS in Mumbai, but she has also undergone specifically training in bioethics as an ethics fellow at the Harvard University of Public Health, Boston. And she has published extensively on women's health and bioethics. So I invite her to announce the first of these awards and a citation for the awards. Over to you.
Thank you very much, Amita. And good afternoon to all people who have come here. And it's an honor to actually be here reading out the citation for the category 1, that is Ashas and ANMs, who've been on the forefront of, the pandemic response in this part in the past 2 years. And it's an honor to read the citation for Ms. Pasavati Muthurangam. Ms. Pasavati Muthurangam was born in Vallur, Chennai, in a middle-class family. After completing her standard 10, she joined service as an Anganwadi worker in Koranjur Reddy Palayam in 1983. In 1990, she completed the multi-purpose health worker training conducted by the government hospital Kanjipuram and resumed her work with the Anganwadi. In 1994, she was appointed as village health nurse in the primary health center, Mailam block. In 1998, she enrolled for a master's program in sociology at the Annamalai University, Chidambaram. She is currently working as the VHN at the PHC of Minjur block. As village health nurse, her duties involve assessing patients, routine immunization, participating in daily vaccine drives. She provides care to pregnant women and ensures their registration on the Pregnancy and Infant Cohort Monitoring and Evaluation Scheme portal, apart from organizing medical camps where health education is provided. During her routine duty, she interacts with people from different communities, including tribal groups. Pasavati provides basic healthcare to the Narikuruvar community, an indigenous tribal group in Tamil Nadu that originally lived by hunting but now makes and sells beaded ornaments. The community has little opportunity for schooling and even less for systematic learning about health and hygiene. They were reluctant to take the COVID-19 vaccines, making it challenging for health workers to convince them of the need for vaccination. Also, given their hunting activities, meeting them face-to-face had been difficult. Furthermore, they believe that they are at risk for infection only if they meet people from outside their community and therefore strictly prohibit others from entering their area. Pasavati took it as a challenge and visited every resident to dispense vitamin C and zinc supplements and to check their health parameters such as temperature and oxygen saturation levels. She also tracked home quarantined persons from the community until they became COVID negative. It was her regular outreach to this community, efforts to create awareness among them and providing them with basic healthcare that broke the ice with local population. With such high-risk work, Pasavati herself tested COVID-19 positive during the first wave, which created considerable mental distress to her and her family. Post her recovery, she resumed work and was fully involved in all the inoculation drives and vaccination camps, working for almost 10 to 12 hours a day. She was assigned as a vaccinator of Minjur block. She also brought to the notice of the block medical officer the urgent need to provide vaccination to this ethnic community. In response, he made the vaccines available in a few hours. Due to Pasavati's persistence and determination, the indigenous community finally got vaccinated in the early morning hours as requested by them before they set out to work. Vasavati's work extended well beyond the regular basic health services by helping improve the living conditions of the Narikoruvar community in several ways. In one such instance, Vasavati convinced some of the community members who would involve the children in begging at railway stations and markets to avoid the activity and to keep the children safe from exposure on the streets. The headmaster and the junior assistant of the local higher secondary school actively supported her efforts to ensure provision of education, infrastructure, personal grooming, clothing, etc. to the children of the community. Many others heard of their work by word of mouth and came forward to extend help. Pasavati recommends that we should follow the principle of non-discrimination against all and also accept accountability for one's actions. Her future plan is to facilitate awareness of current biomedical problems and solutions to this community. We are honored to announce Ms. Pasavati Muthurangam as the awardee of the FMES IJME Ethics Award 2020-21 in Category 1, Ashas and ANMs, for her outstanding contribution to ethical practice and improved access to healthcare for the marginalized during COVID-19 pandemic.
Thank you so much, Mala. I think those of us co-hosts who can unmute ourselves, we should give a big hand to Pasavati. Can we do that? And others can actually show the hand clap signal over here. Yes, wonderful. Now I'm going to invite Pasavati to come and share with us a little bit of how her life journey has been, especially her work during the COVID times. I would request her to spend about 6-7 minutes on this.
FMES IJME உயர் அதிகாரிகள் அனைவருக்கும் உறுப்பினர்கள் அனைவருக்கும் எனது இதயபூர்வமான வணக்கத்தை தெரிவித்துக் கொள்கிறேன். தாங்கள் என்னை தேர்ந்தெடுத்து இவர் பெரிய விருதினை கொடுத்ததற்கு நான் மிகவும் மகிழ்ச்சி அடைகிறேன். அம்மா மேற்கொண்டு நான் எல்லாமே ஒரு மாதிரி இருக்கும். நம்ம சமுதாயத்துல அவங்க தனிப்பட்டு தெரியுறாங்க. இது என் மனசுக்குள்ளவே இருந்துட்டே இருந்தது. ஆனா என்னால அதை சரி பண்ணி வருமான்ற சாத்தியமான்றது என் மனசுக்குள்ள கேள்விக்குறியாக தான் இருந்ததுங்க. இந்த கோவிட் டைம்ல நம்ம எல்லாரும் ஒரு விழிப்புணர்வோட அந்த கோவிட் இன்ஜெக்ஷனு மற்ற வகையில நம்ம அந்த தற்காப்பெல்லாம் நம்மளால பாதுகாத்து கொள்ள முடிந்தது. ஆனா அவங்களால அதை ஏற்றுக்கொள்ள முடியாம அவங்க எதுவுமே தெரியாம அந்த சாதாரணமாவே இருந்துட்டு இருந்தாங்க. அவங்கள போயிட்டு கேட்கும் போதெல்லாம் எங்களுக்கு ஒண்ணுமே வராது, எங்களுக்கு இம்யூனிட்டி பவர் தானாவே இருக்குதுன்ற ஒரு கான்செப்ட்ல தான் மேம் அவங்க இருந்துட்டு இருந்தாங்க. சரி, அவங்களுக்குள்ள ஒரு விழிப்புணர்வை நம்ம கொடுக்கணும். மற்றவங்களெல்லாம் நம்ம சாதாரண பீப்புள்ஸ் எல்லாம் அதை ஏத்துக்கிறதுக்கு தயாரா இருக்காங்க. ஆனா அவங்க அந்த இம்யூனைசேஷனோ இதை பத்தியும் அவங்க எதுவுமே கண்டுக்கவே இல்லை, அப்படியேதான் இருந்தாங்க. சரி, அதுக்காக நான் அவங்கள மோட்டிவ் பண்ணணும்னு எனக்குள்ளவே ஒரு ஆர்வத்தினால நான் போயிட்டு அவங்க கிட்ட தினமும் காலையில மாலையில போயிட்டே இருப்பேங்க. போய் பேசுவேன் அவங்க கிட்ட. ஆனா ஒரு ரெஸ்பான்சிபிள் இருக்காது. என்ன ஒரு மாதிரியா அவங்க பேச ஆரம்பிச்சாங்க. இருந்தாலும் நான் விடவே இல்லைங்க.
Just stop sharing the citation. Okay, no problem.
Please continue.
சரி, அதனால அவங்க கிட்ட நான் பேசின அந்த மோட்டிவேஷன் ஸ்பீச் ரீச் ஆச்சுங்க மேம். நல்லா ரீச் ஆச்சுங்க. அவங்க பிச்சை எடுப்பாங்க மேம் ட்ரெயின்ல எல்லாம். அங்கெல்லாம் அந்த பிள்ளைங்கள் எல்லாம் அதெல்லாம் மனசு கொஞ்சம் உறுத்தலா இருந்தது. அதை போய் நான் அவங்க கிட்ட பேசும்போது என்னுடைய ஸ்பீச்சை அவங்க எடுத்துக்கிட்டு அதை அவாய்ட் பண்ணிட்டாங்க. அந்த பிள்ளைங்க பிச்சை எடுக்க வைக்கிறது ஒரு 2-3 பேர் அது மாதிரி ட்ரெயின்ல எல்லாம் பிச்சை எடுக்கணும்னு இருந்ததெல்லாம் அதெல்லாம் அவாய்ட் பண்ணிட்டு அவங்க அதை செய்யலைங்க மேம். அது எனக்கு ஃபர்ஸ்ட் அச்சீவ்மெண்ட். அவங்க பிச்சை எடுக்காம இருந்தது, அது எனக்கு ரொம்ப சாட்டிஸ்பேக்ஷனா இருந்ததுங்க மேம். அதுக்கப்புறமா எஜுகேஷன் கேட்டாங்க. அவங்க எஜுகேஷன் கேட்டாங்க. அப்போ நான் ஸ்கூல் HM சார் அவங்க ஒரு டீம் மோட்டிவேஷனா இருப்பாங்க. அவங்கள போய் அணுகுனேன். நம்ம கொடுக்கலாம் எஜுகேஷன் அவங்க இருக்கிறதுனால சொல்லிட்டு ஈவினிங்னா நாங்க டியூஷன் சொல்லி கொடுத்தோங்க மேம். அதே மாதிரி இம்யூனைசேஷன் அவங்களுக்கு இதெல்லாம் அப்புறம் தான் இம்யூனைசேஷன் கிட்டவே மூவ் பண்ண ஆரம்பிச்சேங்க. அப்ப எங்க பிளாக் மெடிக்கல் ஆபீசர் அணுகுனேன். சார் இது மாதிரி இருக்குன்னு. அவர் ரொம்ப சந்தோஷப்பட்டு உடனே வெஹிக்கல்லாம் ரெடி பண்ணி நைட் டியூட்டி டாக்டரையும் ரெடி பண்ணி ஒரு டீமோட அங்க அனுப்பி வச்சாருங்க. இதுக்குள்ள ஸ்கூல் டீம்ல சொல்லும் போது HM சார் அந்த குரூப் நாங்க இருக்கோங்க மேம், அவங்க எல்லாம் சேர்ந்து உடனே லஞ்ச் முதற்கொண்டு ரெடி பண்ணி ஏர்லி மார்னிங் போயிட்டு அங்கே பிரெட் கொடுத்து தூக்கத்துல இருந்து அவங்களை எழுப்பி பிரெட் காஃபி கொடுத்து அவங்களுக்கு கோவிட் இன்ஜெக்ஷன் போட்டு உடனே லஞ்சு எப்படிதான் ரெடி பண்ணாருன்னே தெரியாது மதுசூதனன் சார். உடனே பின்னாடியே லஞ்ச் வந்துச்சுங்க கொடுத்து நாங்க ரொம்ப ஹாப்பிஸ் மேம், அது பெரிய அச்சீவ்மெண்ட் பண்ணோம். இப்ப எனக்கு ஒரே ஒரு ஆசை, அவங்க வந்து அடிப்படை வசதியே இல்லாம இருக்காங்க. அவங்க பாத்தீங்கன்னா ஒரு மழையும் சரி காடும் சரி, அவங்க அந்த அனிமல்ஸா கூடவே அவங்க ஒரு அனிமல்ஸ் மாதிரி தான் அவங்களுடைய லைஃப் போயிட்டு இருக்குதுங்க. அவங்கள வந்து டோட்டலா சேஞ்ச் பண்ணி அவங்களுக்கு ஒரு அடிப்படை வாழ்க்கை வசதியை ஏற்படுத்தி கொடுக்கணும். அது உங்க மூலம் நான் ஒரு கோரிக்கையா அந்த கவர்மெண்ட் வைக்கிறேங்க மேம். அதே நேரம் என்னுடைய ஹெல்த் டிபார்ட்மெண்ட்ல வந்து பாத்தீங்கன்னா ஐரிஸ்க் மதர்ஸ் நிறைய வராங்க. அந்த ஆரம்பத்துல பாத்தீங்கன்னா 100 ஐரிஸ்க் மதர்னா அதுல வந்து நார்மல் டெலிவரி 75% ஆகும், 25% தான் LSCS அது மாதிரி ஐரிஸ்க்ல முடியுங்க. இன்னைக்கு பார்த்தா நாங்க ஏன் ரெஜிஸ்ட்ரேஷன் பண்ணும் போது 100%ல 99% ஐரிஸ்க் மதரே இருக்காங்க மேம். இதுக்காக நீங்க வந்து ஹெல்த் ஆர்கனைஸ்ல ஏதாவது இதுக்கு என்ன பண்ணலான்றத வந்து கொஞ்சம் பாத்தீங்கன்னா ரொம்ப நல்லா இருக்குங்க மேம். இது என்னுடைய தாழ்மையான வேண்டுகோள். ஐரிஸ்க் மதர் இல்லாத உலகத்தை வேர்ல்ட உருவாக்கணும். அதே நேரம் அந்த நரிக்குறவரும் வந்து நம்மளில் ஒருவரா அவர்களில் நாம இருக்கிற மாதிரி சமநிலையா அவங்க வரணும்னு நான் ரொம்ப ஆசைப்படுறேங்க மேம். இதே நேரம் இந்த அவார்டு எல்லாம் நீங்க கொடுத்து என்னுடைய VHN கேட்டகரியை நீங்க என்ன மட்டும் பெருமைப்படுத்தலைங்க மேம், என்னுடைய VHN கேட்டகரி பெருமைப்படுத்தி நான் என்னுடைய HOD DD சார், DMCHO மேம், CHN மேம், எங்கள் மெடிக்கல் ஆபீசர் முதற்கொண்டு எங்க பிளாக் மெடிக்கல் ஆபீசர் முதற்கொண்டும் என்னுடைய ஜனங்க என்னுடைய பொதுமக்கள் அனைவரும் எங்க ஊர் தலைவர் எல்லாமே எனக்காக வந்து ரொம்ப ஹெல்பிங் மேம். எல்லாருமே பப்ளிக் எல்லாருமே நீங்க கொடுத்த அவார்டுக்காக ரொம்ப சந்தோஷப்படுறாங்க. எங்க மீஞ்சூர் மக்களும் சரி, எங்க டிஸ்ட்ரிக்ட்ல இருந்து எங்க ஆபீசர்ஸும் சரி, எல்லாருமே ரொம்ப சந்தோஷப்படுறாங்க மேம். இந்த நேரத்துல இந்த மகிழ்ச்சியை வந்து எப்படி தெரிவிக்கிறதுன்னு எனக்கே சொல்ல வார்த்தை இல்லை, என்ன சொல்றதுன்னு தெரியலைங்க மேம். இதே மாதிரி நீங்க ஊக்குவிக்கணும். எங்க பிளாக்ல நிறைய பேரை நீங்க பார்த்து ஊக்குவிச்சு இதே அவார்டு இனி வருங்காலத்துல நீங்க கொடுக்கணுங்க மேம். இது மாதிரி நீங்க தேர்ந்தெடுத்து எங்களை மகிழ்ச்சி கடலில் ஆழ்த்ததுக்காக ரொம்ப நன்றி. தேங்க்யூ so much மேம்.
Thank you, Pasavati Chechi, for that wonderful talk. And your emotions were telling us the story apart from what we were reading in the chat itself. So thank you so much for your service to the community. And we are blessed to have people like you around. This crisis would not have gone better without people like you. And even then, we know that there have been many tragedies, but you all have been the oasis in between. So thank you so much. I'm going to invite another one from the FMES family, Dr. Olinda Timms, to announce the next award. And Dr. Olinda Timms is the Adjunct Associate Professor in the Department of Health and Humanities at the St. John's Research Institute, Bangalore. And as Sunita mentioned, she's the author of Biomedical Ethics, which has been she has edited it and it was published by Elsevier, and this was instrumental in mooting this award with the IJME and FMES family, and that is what made it happen. She's also the working editor of the Indian Journal of Medical Ethics. She currently serves as the chairperson of the Institution Ethics Committee of the St. Martha's Hospital in Bangalore and the Bangalore Baptist Hospital. I invite Dr. Olinda Timms to announce the next two awards.
Thank you, Amita. It is my pleasure and privilege, indeed I'm honored to read out the citation for the awardee in category 2, nursing professionals and counselor. And this award goes to Sanjana Chikalkar. Ms. Sanjana Chikalkar has been a highly motivated social worker in the Khan Bahadur Bhabha Municipal General Hospital at Kurla, Mumbai for 25 years. The hospital is located in an area with a largely Muslim and Dalit population, mainly daily wage laborers in the unorganized sector. They have been amongst the most adversely impacted by the COVID pandemic and were put through an existential crisis by the sudden and drastic pandemic lockdown. Sanjana had to creatively navigate the challenges to support patients and their families. She served as a bridge between the treating healthcare providers and patients' families who were cut off from their loved ones. She won the trust of these family members by providing them with psychological support to allay their fears, and she introduced yoga and meditation in the wards, creating a positive environment. Sanjana would tie up with volunteer groups to provide transport and nourishing home-cooked meals to nurses and other healthcare providers in the hospital. Sanjana ensured the uninterrupted supply of protective personal equipment, sanitizers, and toiletries in the first pandemic wave that saw severe shortages of such important resources. Sanjana also coordinated and ensured the supply of oxygen cylinders for patients in the other wards to cover this essential requirement of intensive care. She had tested positive for COVID-19 in June 2020. She recovered and immediately resumed duty after testing negative. Following that, she had a fractured wrist, but knowing that her contribution in the hospital was essential, she continued work without doing any writing on those days. Sanjana's dedicated involvement has led to a sea change in the hospital's resource management and in transforming the patient's perceptions about the hospital. We are delighted to honor Ms. Sanjana S. Chikalkar as the awardee of the FMES IJME Ethics Award 2021 in Category 2, Nursing Professionals and Counselors, for her outstanding contribution to ethical practices and improving access to healthcare for the marginalized during the COVID-19 pandemic.
Thank you so much. Let us give a big hand to Sanjana. Those who can unmute, others can give the clap signal. अब हम संजना से सुनना चाहेंगे कि उनका कैसे एक्सपीरियंस रहा है काम का।
पहले तो मैं FEMC और
आपका चेहरा कैमरा पे नहीं आ रहा है ठीक से, आप थोड़ा एडजस्ट करेंगे। हाँ, अभी ठीक आ रहा है,
थोड़ा उंचावर
हाँ
ओके
आणखीन थोडं उंच, हाँ
आणखीन उंच,
हाँ आता आला व्यवस्थित,
उभा करू दिसतंय। सबसे पहले मैं FEMC एंड IJMC का बहुत बहुत धन्यवाद बोलती हूँ। मुझे इस अवार्ड के लिए चुना गया है और बहुत ग्रेट फील कर रही हूँ। मैं अपने आप को बहुत अभी तक बहुत छोटा समझती थी, लेकिन आज ऐसा लगता है सच में मैं बहुत काम करती हूँ और ये मुझे FEMC ने बता दिया है और सेहत ने मुझे इसके लिए रिकमेंडेशन दिया है। इसे मैं पहले सेहत का भी बहुत बहुत धन्यवाद करना चाहूंगी। यहाँ पे पेंडेमिक के बारे में अगर मैं बोलती हूँ तो एकदम शुरू से बात करेंगे हम, तो जब हमको पता भी नहीं था कि इसमें क्या चाहिए, हमको कौन से साधन लगेंगे, यहाँ से हमारी शुरुआत हुई थी। और साधनों में भी जैसे मार्च 22 2019 को कोविड आया है और उसमें हॉस्पिटल ने थोड़ा सा अपना जस्ट इंफॉर्मेशन मिली थी तो हमने थोड़ी सी तैयारी की थी, जिसमें जो सारे साधन थे वो हमारे ही थे, हमारे इन द सेंस हॉस्पिटल के ही थे। और लेकिन इससे हमको पता नहीं था कि और क्या क्या चीजें हमको लगेगी। और आप तो समझते हैं कि ब्यूरोक्रेसी में काम करते समय और गवर्नमेंट सेक्टर में काम करते समय साधनों का व्यापन करना, इन्हें जमाना, ये बहुत बड़ा चैलेंज था हमारे लिए सबसे पहले। और ऐसा था कि जहां मैं काम कर रही हूँ कुर्ला एरिया में, वो मैडम ने अभी बताया है कि बहुत ही मतलब मार्जिनलाइज्ड ग्रुप है और बहुत ही हम बोलेंगे कि एरियाज वो जो है काफी लेबरर एरिया है और बहुत गरीब हम बोलेंगे, जो कमाना भी नहीं जानते हैं ऐसे, और काफी सारे ऐसे लोग हैं जो बाहर से यहाँ आए हैं और इतने झोपड़पट्टी में रहते हैं। मतलब पूरा कम्युनिटी बहुत छोटा एक ऐसा है, लेकिन एरिया आप देखें तो 9 लाख के आसपास है ये एरिया और बहुत ही गर्दी वाला जैसे हम बोलेंगे ऐसा इस तरह से एरिया है। तो पेशेंट का आना इतना फास्ट हुआ हमारे लिए कि हम लोगों को साधनों का इकट्ठा करने के लिए भी हमें ये नहीं मिला। बाद में जो ये बोलेंगे कि कोविड में जो बजट वगैरह जो आया वो बहुत बात की बात थी, लेकिन मार्च में हमको इतना ज्यादा इस चीज का दुख उठाना पड़ा कि हमारे पास साधन बिल्कुल भी नहीं थे। उसमें मेरे लिए ये बहुत बड़ा चैलेंज था, क्योंकि सोशल वर्कर ने ये करना है, सोशल वर्कर ने वो करना है। आप समझते हैं कि किस तरह से गवर्नमेंट हॉस्पिटल्स में ऐसा होता है कि सारी चीजें इस पे होती है। फिर भी ये एक चैलेंज लेते हुए मैंने काफी सारे जो लोग थे, 25 साल में काफी सारे हमारे संपर्क में लोग आ चुके थे, काफी सारे एनजीओ थे। अगर आप बोलेंगे तो पॉलिटिकल पार्टीज बोल सकते हैं, या फिर एनजीओ बोल सकते हैं, पर्सनल जो वॉलंटियर्स होते हैं, पर्सनल डोनर्स जो होते हैं, धर्मदाय आयुक्त जो होते हैं, ऐसे लोगों को मैंने सबको इकट्ठा करना शुरू किया, या फिर सबको कांटेक्ट किए हम लोगों ने। और कांटेक्ट के समय सबसे पहले हमको यूनाइटेड वे करके एक बहुत बड़ी CSR के संस्था है, उनके मोहन जी मुझसे मिले। वो हमारे सर से मिलने के बाद उन्होंने बोला कि नहीं, आप संजना को मिलिए, इसके बारे में वही आपको ठीक से बता सकते हैं हमें क्या चाहिए। उन्होंने इतना अच्छा सर्वे किया, थैंक्स टू यूनाइटेड वे और थैंक्स टू डॉक्टर पिंपड़े, उन्होंने मुझ पर भरोसा किया और ये सारी साधन सामग्री जमाना। तो सारी चीजें बहुत लेट आना शुरू हुई थी, पेशेंट बहुत ज्यादा थे और पेशेंट को ये भी पता नहीं था कि हाँ कोविड क्या है। हम लोगों ने जो इंतजाम किया था कि उनको एक जगह रखने के लिए, तो हम लोगों ने कुछ कांच के दरवाजे बनाए हुए थे उनको क्वारंटाइन करने के लिए। तो उनको क्वारंटाइन क्यों किया गया है ये भी पेशेंट को या फिर उनके फैमिलीज को पता नहीं था। एक रात में तो ऐसा हुआ, मैं किस्सा जरूर बताना चाहूंगी आपको, कि सारे पेशेंट ने उठकर वो दरवाजा इस तरह से ढकेला है, इस तरह से ढकेला है कि उन्होंने वो कांच तोड़ दी थी। और फिर उनको ये बात समझाना कि आपको हम लोगों ने क्वारंटाइन क्यों किया है, ये मेरे लिए बहुत बड़ा चैलेंज था। और मैंने उस समय पीपी किट पहन के अंदर जाके पेशेंट से बात की कि आप लोगों को क्यों इस तरह से रखा हुआ है, क्योंकि आपके घर वालों को, हमको या डॉक्टर्स को आपकी सारी तकलीफें हम देख रहे हैं और हम समझ सकते हैं, क्योंकि इसके बारे में किसी को भी पता नहीं है। ये साथ में रहने से ये बीमारी हो सकती है, इसलिए आपको क्वारंटाइन किया और आप बाकी बीमारियों जैसा ही इसको लीजिए। इसको ये मत समझिए कि हमको अलग रखा गया है, हमको कुछ होने वाला है। ये समझाना बहुत 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 मुश्किल था हमारे लिए, बहुत मतलब बहुत ही मुश्किल था। और ये भी दूसरा एक चैलेंज था कि उनको कैसे समझाए, अंदर के पेशेंट को समझाना और परिवार को समझाना, ये भी बहुत बड़ा चैलेंज था। परिवार वालों को समझना, फिर उनका थोड़ा सा ऐसा ही होता था कि नहीं, हम लोग इस ये बस्ती से है इसलिए ये गवर्नमेंट हॉस्पिटल कुछ नहीं कर पाएगा। तो उनको ये भी बताना जरूरी था कि गवर्नमेंट हॉस्पिटल में जो प्रैक्टिसेस है वो आपके लिए बहुत अच्छी है और इसमें आपको किसी भी तरीके का डर नहीं है, आप ठीक हो सकते हैं, आप नेगेटिव होने के बाद हम आपको छोड़ देंगे, इस तरह से। एक मैं किस्सा जरूर सुनाना चाहूंगी कि एक इंस्पेक्टर थे हमारे, वो 5 बार पॉजिटिव आए। उन्होंने मुझे बोला, मैडम कुछ करो, मुझे अभी नहीं रहना है, बहुत बहुत हो गया है ये, अभी मुझे आप कुछ भी करो, चाहिए तो मुझसे ना डोनेशन ले लो और मुझे छोड़ दो। तो मैंने कहा ऐसा नहीं है, आप जब तक ठीक नहीं होते तब तक हम आपको छोड़ नहीं सकते। लेकिन उन्होंने एक बात बहुत अच्छी की कि मैडम आप पीपीई किट पहनकर अंदर आते हैं, तो उन्होंने हॉस्पिटल के अंदर जहां वो क्वारंटाइन थे बाकी लोगों की मदद करना शुरू कर दिया था। ये मेरे लिए बहुत अच्छी बात थी उनकी, और उनको भी मैं अभी भी धन्यवाद दूंगी। उनको पता भी नहीं है कि मुझे इस तरह का अवार्ड मिला है करके, तो उनको मैं जरूर फोन करके, उन्होंने अपना नंबर दिया है मुझे बाहर निकलते समय। और दूसरा ये था कि पेशेंट के लिए अभी आते थे पेशेंट, तो उनके पास कुछ भी नहीं होता था, कुछ भी नहीं, मतलब कुरला में आप देखिए इकोनॉमिकल प्रॉब्लम्स है, साइकोलॉजिकल प्रॉब्लम्स है, सोशल प्रॉब्लम्स है, बहुत सारी चीजें हैं। तो एक तो था कि पेशेंट क्वारंटाइन होने के बाद उनको उनका खुद का पर्सनल किट देना मुझे बहुत अच्छा लगता है, मतलब पसंद था, और मैंने ये चीज सर के सामने रखी। और फिर कुछ डोनर्स को मैंने बोला कि पेशेंट के पास कुछ भी नहीं होता है पर्सनल, वो एक दूसरे का सामान लेते हैं, ये करते हैं, तो क्यों ना हम एक हेल्थ किट बनवाए। तो उसमें एक फेस टॉवेल था, एक बाथ टॉवेल था, टूथपेस्ट, टूथब्रश, देन कोम, ऑयल, कपड़ा का सोप एंड नहाने का सोप, ये सब 5-6 चीजें हम लोगों ने किट में बनाई और बहुत अच्छे तरीके से पेशेंट को बताया है कि देखो आपको इसी चीज से आपको रखना है, क्योंकि आप घर की चीजें ला नहीं लेकर जा सकते, अंदर लेकर नहीं आ सकते और बाहर नहीं जा सकते। उसी तरह फिर बीच में एक ऐसा आया था कि ये लेना है आपको, स्टीम लेना है स्टीम के लिए, तो वो स्टीम के कप किस तरह यूज करना है उनको, ये हमने बताया। क्योंकि गर्म पानी पीना है, ये जो बाहर बाकी चीजें बोल रहे थे लोग, मेडिसिन तो हम लोग सिम्टोमेटिक कर रहे थे, मेडिसिन जो थी वो सिम्टोमेटिक थी, खांसी है तो खांसी का दवा दिया, ये है तो वो दिया जाए, लेकिन बाकी की जो चीजें थी, स्टीम लो, खाना अच्छा खाओ, अच्छा डाइट रखो, इस तरह के लिए। तो हमारे हॉस्पिटल में तो डाइट के लिए कोई कमी नहीं थी, हम लोगों ने बहुत सामान इकट्ठा किया। सिर्फ पेशेंट ही नहीं, डॉक्टर्स के लिए भी बहुत सारे चैलेंज थे। उनको एक बार 8 घंटा अंदर जाने के बाद में उसी किट में रहना है, उसी उधर ही उनको खाना लेना है। तो और क्या होता था कि काफी लंबा से लोग आ रहे थे, मतलब डॉक्टर्स भी काफी लंबे रहने वाले थे, और काफी सारे नर्सेस थी, वो जो भी बदलापुर, देन अमरनाथ, ये बहुत लंबी लंबी एरिया है मुंबई में, जो कुर्ला आने के लिए काफी प्रॉब्लमेटिक थी। उस समय उनका रहने का साधन, क्योंकि हमको सेवा देनी है, पेशेंट को सेवा देनी है, कोविड में काम करना है, काफी बड़ा चैलेंज है, तो वो ग्रुप वर्क से नहीं होगा। ऐसा मैसेज हम रोज डॉक्टर्स को, नर्सेस को देते थे कि आपकी वजह से ही ये लोग हैं और आपकी वजह से ही हम लोग हैं। नहीं, आप अगर इस तरीके से सेवा दे रही हैं तो कहीं ना कहीं आप लोगों को पेशेंट का भी एक सेटिस्फेक्शन मिले, और अपने काम का भी सेटिस्फेक्शन मिले, क्योंकि ये हमारा काम है। ऐसी बातें रोज नहीं होती है, हम रोज पेशेंट देखते हैं, तो ये हमारे लिए बहुत स्पेशल चीज है। तो इस तरह से हम लोगों ने नर्सेस को वगैरह ट्रेनिंग दिया, देन किस तरह से किट पहननी है, किस तरह से डिस्क्लोज करना है, ये अलग से हम लोग ने हर, मतलब सिर्फ कुर्ला में नहीं, मेरे पास में काफी सारे हॉस्पिटल और भी थे, जैसे जम्बो कोविड सेंटर वगैरह होते, वहां पे जो एम्प्लॉयज लिए थे वो काफी सारे कॉन्ट्रैक्ट पे थे, और वो लोग बेचारे सेवा दे रहे थे, बहुत अच्छी तरह सेवा दे रहे थे। तो उनको उनकी जान संभाल कर किस तरह सेवा देनी है, इसके लिए भी हम लोग ने ट्रेनिंग पे बहुत ये किया। मेरे शायद मैंने काफी वीडियो भेजा है, उसमें आपको देखने मिलेंगे। वीडियो में बहुत सारी चीजें हैं जो मैंने लिखी नहीं है, और बहुत सारी चीजें मैं बोल रही हूँ, ये थोड़ी अलग हो सकती है, क्योंकि हम लोग खुद को एक्सप्रेस करते समय कुछ काफी सारे हमारे जहन में सोच आती रहती है। तो ये एक हम लोग ने ट्रेनिंग, तो जो जितने भी हमारे कॉन्ट्रैक्ट के वर्कर्स थे, फिर लेबर्स हो सकते हैं, आईएबआई हो सकती है, सुपर हो सकते हैं, सारे लोगों को हम लोग ने ट्रेनिंग दिया। स्पेशली आप ठीक से बात करो, क्योंकि आपने देखा होगा, आप को सभी जगह बोलते हैं कि नहीं, गवर्नमेंट हॉस्पिटल में अच्छे से बात नहीं करते, ये नहीं होता है, वो नहीं होता है, लेकिन हम लोगों ने उनको बिल्कुल साइकोलॉजिकल टर्म्स में, क्योंकि ये चीज में हमारे से भी हो सकती है, कल हम भी इस माहौल से जा सकते हैं, इसलिए कि जो दुखी है उसको कुछ भी पता नहीं है उसके बारे में, तो सिर्फ आप उनसे ठंडे दिमाग से बात कीजिए। हम पता है, हम रोज एक चीज करते तो थोड़ा इरिटेशन होता है, कुछ प्रॉब्लम होते हैं अपने घर में, तो हम उसको भी बीच में लाते हैं। तो इस तरह ऐसा ना करते हुए हर पेशेंट से, हर फैमिली से आपको बहुत स्वीटली, बहुत अच्छे से बात करना है, अपने आप पर संयम रख के बात करना है। तो ये हम लोगों ने उनको सिखाया था कि हाँ, यहाँ जाओ, वहां जाओ नहीं, आप उनको प्रॉपरली नंबर बताओ, या फिर अकम्पनी करो उनको, वहां लेकर जाओ, इस तरह से। और काफी बार हमको फैमिलीज को बहुत सपोर्ट करना पड़ा, क्योंकि फैमिलीज काफी एंगर, एंशियस थी कि इस तरह हो रहा है, बंद करके रखते हैं, कुछ दे तो नहीं रहे हैं, 4 दिन हो गए, आज 5 दिन हो गए, आप हमारे पेशेंट को छोड़े नहीं है, क्योंकि पेंडेमिक के बारे में उनको पता ही नहीं था। तो इस तरह से हम लोगों ने उनको
आपके पास 1
समझाने की
मिनट है।
कोशिश की। हाँ जी, हाँ जी। 1 मिनट है, वहाँ पे बहुत सारा बोलना है मैम। मुझे तो खत्म ही नहीं कर पाऊंगी मैं। तो ये इस तरह से, तो हम लोगों ने काफी सारे साधन सामग्री तो मैंने इस तरह से जमाई है कि मुझे खुद भरोसा नहीं हो रहा था। एक बार तो पूरा ट्रक जूस का आ पड़ा, एकदम फुल ट्रक मंगा लिया था, और उसके लिए फिर मैंने सोचा कि नहीं, कुर्ला भाभा में इतने सारे 16 सेंटर है, एक वार्ड होता है, उसमें 16 हेल्प पोस्ट होते हैं, वहां की जो 3000 आया वंशी वर्कर्स है, वो लोग घर घर जाके इंफॉर्मेशन दे रही है, पेशेंट को ला रही है, सपोर्ट कर रही है। तो मुझे ऐसा लगा उनके लिए भी हमने कुछ करना चाहिए, इसलिए मैंने हर 16 पूरे डिस्पेंसरी में सारे जूसेस के बॉटल्स है, कोकोनट ऑयल है, मैगीज है, ओट्स है, काफी सारा सामान आया था जो मैंने हर एक को मिलना चाहिए, इस पर थोड़ा ध्यान दिया। और डॉक्टर्स के लिए भी हम लोगों ने, खाना तो रोज आता था, काफी लोग हम लोग को खाना लाकर देते थे, लेकिन मैंने उनको बोला कि थोड़ा सा चेंज कीजिए, क्योंकि रोज खाना क्या होता है, तो वही खाना खा के उनको लग रहा था। तो फिर हम लोगों ने थोड़ा इवनिंग स्नैक्स के लिए वगैरह बोला था काफी लोगों को, और सच में उन्होंने हमको बहुत बहुत मदद की है। सब लोगों ने जिन्होंने भी किए हैं उनमें सारे एनजीओज वगैरह आते हैं। और इसी दौरान हम लोगों के अभी मैं दिलासा में काम करती हूँ, डोमेस्टिक वायलेंस हेल्थ इश्यूज पे काम करती हूँ, मैं काउंसलिंग का काम करती हूँ। इसी बीच काफी सारे मतलब क्लाइंट्स के कॉल्स आते थे, उनको घर में तकलीफ हो रही है, क्या करना चाहिए क्या नहीं करना चाहिए। वो कॉल्स भी अटेंड करने के लिए मुझे बहुत आनंद मिलता था, उनसे घंटों बातें करते समय बहुत आनंद मिलता था, क्योंकि वो एक बार मुझे बताए और वेंटिलेटर हो जाए तो शायद उसका दिन अच्छा जाए, ऐसा मैं सोच के उनको हमेशा टाइम देते आई हूँ। ऐसा भी है कि काफी सारे पेशेंट ऐसे थे कि जो कोविड के समय उनको बाहर निकाल दिया गया, जो जनरल पेशेंट थे। उसमें एक एक्सीडेंट पेशेंट था मेरा जिसके दोनों टांगे कटी हुई थी। उसको कहाँ रखना है ये मेरे लिए बहुत बड़ा चैलेंज था, क्योंकि वो बिहार से था और रेलवे से उसका एक्सीडेंट हो गया था। थैंक गॉड कि उसका एक पैर अपने आप ठीक हो गया था और दूसरा पैर के लिए उसका सर्जरी की बहुत जरूरत थी। मैंने उसको जे घुमाया, कुर्ला में 1 महीना रखा, BDBI में 1 महीना रखा। लास्ट फिर इस तरह कांटेक्ट में ही डॉक्टर ऑर्थो के डॉक्टर ने मुझे एक रेफरेंस दिया और फिर मैं जे में जाकर उसका ऑपरेशन करवाई। वो भी मेरे लिए बहुत अचीवमेंट की बात है कि मैं उसको बहुत अच्छी तरह हेल्प कर रही हूँ, और भी उसके आर्टिफिशियल लिम्ब के लिए मेरा काम चालू है। और ये मेरा बहुत करंट और बहुत मतलब प्राउड इशू लगता है, क्योंकि मुझे बहुत पसंद है महिलाओं बच्चों के साथ काम करना। थैंक यू। शायद बहुत बोलना है मुझे, लेकिन समय नहीं होने की वजह से
थैंक यू सो मच संजना ताई। और ये तो एक जीता जागता उदाहरण है ये भी, और बाकी अवार्डीज भी, जो हम बोल रहे थे कि सरकारी सेवा ने कितना अच्छा काम किया
है
टाइम में। हाँ, तो आप तो उसका जीता जागता उदाहरण है सभी बाकी अवार्डीज के साथ। सो वेरी हैप्पी टू लिसन टू यू। थैंक यू सो मच।
Congratulations.
And I would invite Olinda again to announce the next award.
I'm honored to read out the citation for the awardee in category 3, which is the citizen groups formed during the pandemic. The initial reports of SARS-CoV-2 in Jan 2020 were followed by the Indian government's sudden announcement of lockdown with effect from the midnight of March 24th. This resulted in millions of migrant workers being trapped in cities, facing job loss, starvation, and separation from their families. Lakhs of workers started walking or cycling back home to their distant villages, hundreds of kilometers away. Witnessing their suffering, a group of volunteers began an initiative called Stranded Workers Action Network, or SWAN. And they came together to set up zonal helplines to help meet the most basic needs of food and water for these migrants. These helplines connected callers in distress to the nearest individuals and organizations who reached out with food and water. By July 2020, more than 130 volunteers were working across multiple states, and SWAN had reached out to 36,000 workers. SWAN routed the distress calls to different zones across the country and allocated teams to assess workers' and migrants' needs. This required volunteers to be proficient in multiple languages. About 3,200 individuals required medical assistance, including pregnant and lactating women, and children and elders with epilepsy, cancer, and other chronic issues. SWAN is also engaged in writing about the crisis in the media, providing real-time data for advocacy and legal purposes. The organization has since launched a SWAN fellowship from Jan 2021, and it currently supports 8 migrant workers as fellows and provides them with a platform to voice their concerns to a larger audience. We are proud to announce SWAN as the awardee of the FMES IJME Ethics Award 2021 in category 3, that is citizen groups formed during the pandemic, for their outstanding contribution to ethical practices and improving access to healthcare for the marginalized during COVID-19 pandemic.
Thank you. Let's give them a big hand. Super congratulations to you. And we invite you to come and share your thoughts with us.
Hello everyone, good evening, namaste. I am Jeenia Chatterjee and I feel very, very honored and blessed to be here as a representative of the Stranded Workers Action Network today. So just taking you through how all of this started, how we came to form this network, what kind of challenges we faced, and how all of this came to be what it is known as today. So it was March 2020, just 1 week, and the lockdown had started. Like everyone around the world, I was totally clueless as to what was going on, how things would shape up in the future. And at that time, the lockdown was supposed to be for 3 weeks. Slowly, we started getting to know that there were workers in different parts of the country who were stranded and they were facing a lot of problems. So I got a message on one of my college groups saying that if anyone is interested in volunteering to help out these stranded workers, you can get in touch with us. So because I had a lot of time on my hand and I thought, why not do something to help those who are in distress, I decided to give it a go. And then we were explained what we were supposed to do. We were getting first-hand data from either workers who were stranded or from organizations who were similarly working on the ground level to help these workers. And initially, it just started off as a group of volunteers with one Excel sheet, putting in the data and calling up the workers to assess their needs. ये हमें समझना था कि उन्हें क्या-क्या चाहिए. Are they in need of food, water? Are they in need of money? And then slowly, once we started calling people up from our personal numbers, that also, because it was a very informal network initially. And then slowly it spread out to more and more workers in different zones all across the country. And बहुत सारे लोग हमें फोन करने लगे कि हमारे पास खाने पीने के लिए कुछ नहीं है, गैस खत्म हो चुका है, हम क्या करें. तो धीरे धीरे हमने उन्हें इन ऑर्गेनाइजेशन से कनेक्ट करना शुरू किया जो उन्हें फूड एंड वाटर प्रोवाइड कर सकते थे, जो उन्हें राशन किट्स प्रोवाइड कर सकते थे. एंड इस तरह से हमने इसे एक फॉर्मल नेटवर्क बनाया. और भी ज़्यादा वॉलंटियर्स हमारे साथ जुड़े और हम उनके नीड्स असेसमेंट करते थे, उन्हें अलग अलग इंडिविजुअल्स के साथ, अलग अलग ऑर्गेनाइजेशंस के साथ जोड़ते थे जो उनकी मदद करते थे. एंड इट वाज नॉट जस्ट अबाउट द फूड एंड वाटर. A lot of people were struggling with young children. There were many workers whose wives were pregnant and they had no access to medicines and medical facilities at that time. So we slowly had to expand our network to include hospitals and other government centers. We had to let people know what was the plight of people all around the country. And also, because the lockdown got extended, we then had to start looking at travel options. Because जहाँ पे वो थे, वहाँ पे काम का और कोई चांस ही नहीं था उनके पास. तो धीरे धीरे ये राशन किट्स, फूड एंड वाटर से ट्रैवल तक गया, मेडिकल फैसिलिटीज, ये सारी चीज़ें हमने इंक्लूड की हमारे सर्विसेज में. एक फॉर्मलाइज्ड नेटवर्क हमने तैयार किया और इन सभी चीज़ों में जो इंडिविजुअल्स हमारे साथ जुड़े, जिन्होंने मॉनेटरी कॉन्ट्रीब्यूशंस किए, जिन्होंने हमें ऑर्गेनाइजेशन से जोड़ा, जो ग्राउंड लेवल पे उनके घर घर तक जाकर उन्हें ये सारा खाना और ये सारी फैसिलिटीज़ पहुंचा रहे थे, उनके बिना ये बिल्कुल भी पॉसिबल नहीं हो पाता था. एंड एक और सबसे बड़ी चीज़ ये हुई कि धीरे धीरे हमें मीडिया कवरेज भी मिलना शुरू हुआ. सो अ लॉट ऑफ आवर volunteers, a lot of our fellow members were invited on national news channels to speak to the people, to speak to the citizens, to appeal to the government so that they could actually see what was going on in the country. And I was privileged enough to have been invited on the Z24 Hours Bangla, where I spoke about the reverse migration, employment, and all of these issues that were cropping up because of the pandemic. And what I personally felt throughout this whole journey was that times were very difficult. Nobody knew what was going on, but it was just this need to do something. It was this idea to, the place of privilege where we all came from, that because we had access to so many facilities, that we could actually reach out to so many people, speak to them, help them understand what the plight of people in our country was. And that is the reason we actually got to help them. So I realized that no matter how dire the circumstances are, if you want to do something to help people, you can actually make the world a better place to live in. And Swan has been one of the most enriching experiences of my life. It's so fulfilling to have been able to do something, and this recognition is just like a cherry on the cake. And now I would like to hand it over to my fellow volunteer Anish to tell you a little more about the impact that we have had as an organization.
Thank you so much, Jinya. Can you hear me? Okay. So, yeah, you might not, it's not too surprising, but yeah, as an online network, I have never met Jinya in person, nor have I met most of my fellow volunteers. I think there are 100 odd people, more than that, who have joined in time and again to help out. And very few of us have actually met each other or knew each other before. But I guess the crisis and privilege, we were able to come together to make a little bit of a difference. And so Swan kind of happened, Jinya put it very well, how we came together in the first wave. But as the wave went away, we thought, okay, now we can gradually stop doing this because it's not sustainable. Swan was like almost this, someone's described it as a helicopter organization that came in a time of crisis. And something important that it was able to do was it was able to arrange cash in hand for these stranded workers. They were able to get maybe some rations, some cooked food here and there. But what about like the day-to-day needs, like maybe recharging their phone or something else that is a priority for them? So I think these micro transfers that we were able to facilitate were of some use to them. And I think Swan that way is a good example of a crowd-funded project where the money was directly transferred from the donors into the accounts of the migrant workers always, where as far as feasible. So that way we were able to raise over 90 lakhs and donors came forward. And that is like, I think, an important part of why Swan was a little successful. And so once the first wave began to go away, we were trying to see what all else we could do. And someone was came up with the idea of doing a press conference. But generally, we had been going to, like Jinya said, we had been going to some news channels and different, we were writing in papers, etc. But we were also able to organize a press conference where the migrant workers themselves spoke about their situations. We invited journalists, as in any press conference. And I think that platform was quite important. And those conversations were very, very important. And from that, there came this idea of maybe we can try through the resources that we have mustered to have a platform, because we saw how keen a lot of migrant workers are maybe to upskill, maybe to get their stories out, to tell their stories themselves. So we were able to form the Swan Fellowship that would support, started off by supporting 6 migrant workers. Now I think it's at 8. And we are continuing to do so, again, with the help of this grant from IGME. So we are, again, IGME, we are very grateful for that. And this fellowship also has been, I think, quite useful and interesting, because we have storytelling workshops, we have filmmaking workshops, we have workshops about rights and policies. And those conversations, I think, are also helpful. And now, gradually, all the fellows in their own rights, as well as maybe through this fellowship, are becoming community leaders, are joining other circles, other networks of migrant workers, of social workers. And that is also, I think, creating an impact. And then the second wave came, the Delta wave came, and that was truly heartbreaking. And we all got on a call again, and we were all talking that, okay, what should we do? Should we again get back into this kind of a mess, and should we again put ourselves into it? And there were, at one point there was almost silence, but then someone said, no, we have to do this, come on, and we have the resources, we know how to do it, so we should. So again, we are all able to kind of band together. And so this happened in 2 halves. Almost every time we raised something like 40 lakhs, and donors came forward to help. We reached out to our old donors, they were happy to help. We remembered the networks we had reached out to for cooked food, for ration delivery, and we were again able to, with their help, help out. I think help out a few people again.
You have 1 minute.
Yeah, 1 minute. Okay, yeah. So that was kind of Swan 2.0. We again wrote a report, which I think is an important archive of everything that happened again in this in that second wave. And we again culminated with another press conference, again for where the migrant workers were the stakeholders. And and since then we have been continuing in the form of a fellowship. Wherever it's possible, we have been trying to highlight this issue, since it's a recurring issue. There are multiple aspects to this problem that became very, very apparent due to this pandemic. And thank you once again for recognizing this effort, and congratulations to everyone else who has been recognized. Thank you so much.
Thank you, Jinya and Anish, both of you, for putting it out. The picture came alive for us. And I know it was a really difficult time, but your stories make us feel that change is possible, new things and help is really possible. So we were planning a 5 minutes interaction, but I think in the interest of time, we'll keep the interaction at the end. So I invite Professor Mala Ramanathan again to announce the next set of awards.
Thank you, Amita. It's an honor to read the citation for A. Kokila, an award of appreciation in category 1 again for Ashas and ANMs. Miss A. Kokila is an Asha worker in Vellakavi village, 6 kilometers from Vattakanal, near Kodaikanal in Tamil Nadu, which takes about 4 hours to reach on foot. It is surrounded by dense forests and difficult terrain. She serves the Manadiyar and the Paliyar communities of her village, whose main occupation is agriculture. Pregnant mothers have to access a general hospital either in Kodaikanal or in Periyakulam a month earlier for institutional delivery, and Kokila provides excellent support to the village health nurses in mobilizing the women of the village for institutional delivery and postnatal care. Her contribution over the past 10 years to make Vellakavi, the village, qualify for zero infant mortality is a remarkable achievement. With her sustained efforts and perseverance in creating awareness among the villagers, she was able to achieve full COVID-19 vaccination coverage in this area. Kokila's village is far from the reach of vehicles, and only horses can pass the difficult paths to deliver any service. Kokila has to work for 3 to 4 hours after visiting the healthcare center to which she is associated. In spite of those difficulties, she has been instrumental in delivering all possible services to the community with the guidance of the village health nurse, the community health nurse, that is CHN, and the medical officer, MO. She finds the community she serves is very positive in its attitude to her. The difficult terrain actually requires her to hire a horse for transporting healthcare materials to the community. She spends most of her earnings in the travel for work. Her husband accompanies her often because she can't walk the paths alone for fear of wild buffaloes. Her passion for care and to serve her community have transcended all these challenges. Kokila is interested in pursuing further education. She is studying for higher secondary course through private tutorial center, and her aim is to become a village health nurse and continue serving her own community. It is humbling to know of her work, dedication, and tenacity in navigating through these complex and challenging situations, which are more routine than an exception in her work. It is with great pleasure that we honor Ms. A. Kokila with the Award of Appreciation under the FMES IGME Ethics Award 2020-21 in Category 1, Ashas and ANMs, in recognition of her outstanding contribution to ethical practice and improving access to healthcare for the marginalized during the COVID-19 pandemic.
Thank you so much. Let us give a big clap to Kokila Chechi. And Kokila Chechi, can you also talk with us a little bit about your experiences?
அனைத்து உயர் அதிகாரிகள் அனைவருக்கும் என் இனிய மாலை வணக்கத்தை தெரிவித்துக் கொள்கிறேன். எனக்கு இந்த விருது கொடுத்ததுக்கு ரொம்ப நன்றி. எனக்கு very very happy ma'am. Thank you so much. என்னோட பேர் வந்து கோகிலா. நான் வந்து வெள்ளகி வில்லேஜ்ல வந்து ஆஷா ஒர்க்கரா வேலை பார்த்துட்டு இருக்கேன். 10-11 கிலோமீட்டர் இருந்து தான் நான் நடந்து வந்து, அதாவது ஏஎன்சி பிஎன்சி வயதானவருக்கெல்லாம் டேப்லெட் எடுக்கணும். டேப்லெட் எடுக்க போயிட்டு, அதாவது 10-11 கிலோமீட்டர் வந்து நடந்து போய் கொடைக்கானல்ல இருந்து பஸ் ரூட் வந்து 12 கிலோமீட்டர் பஸ் ரூட்ல போய் அடுத்து பிஹெச் பெருமாள் மலை பிஹெச்ல போய் டேப்லெட்லாம் எடுத்து திரும்ப அதே பஸ் ரூட்ல வந்து 10-11 கிலோமீட்டர் வந்து நான் நடந்து வந்து தான் இந்த வேலையை வந்து பார்த்துக்கிட்டு இருக்கேன். அதாவது மக்களுக்கு வந்து ஒரு சேவை மாதிரி செய்யணுன்றதுக்காக தான் நான் இந்த வேலையை சூஸ் பண்ணினேன். அடுத்து வந்து ஏஎன்சி, அதாவது பிரெக்னன்சி லேடிஸ் வந்து செக்அப்புக்கு கூட்டிட்டு போறதுல இருந்து டெலிவரி ஆகிற வரைக்கும் அவங்களோட ஒன்னாவே போயிட்டு செக்அப்லாம் போயிட்டு திரும்பவும் அவங்களே கூட்டிட்டு வந்துட்டு 7 மாசத்துல வந்து அவங்கள வந்து ஜிஹெச் பெரியகுளம் ஜிஹெச் அல்லாட்டினா கொடைக்கானல் ஜிஹெச்ல வந்து டெலிவரிக்கு கூட்டிட்டு போயிடுவேன். அங்க போய் விட்டுட்டு அவங்க டெலிவரி முடிஞ்சு 1 மாசம் கழிச்சு தான் அவங்கள கீழே கூட்டிட்டு வந்துட்டு அவங்களுக்கு பிஎன் கேர் அதாவது குழந்தைகளை வந்து எப்படி பார்த்துக்கணும், ஃபீடிங் எப்படி பண்ணணும், இம்யூனைசேஷன் எப்படி பண்ணணும், அதை எல்லாத்தையும் சொல்லி கொடுத்துட்டு திரும்ப அது போலியோ கொடுக்கறது, அதே வேக்சின் எடுக்க 10-11 கிலோமீட்டர் நடந்து வந்து பிஹெச்க்கு வந்து வேக்சின் எடுத்துட்டு திரும்ப போயிட்டு பிள்ளைங்களுக்கு கொடுத்துட்டு திரும்பவுமே கொண்டு போய் அதே மாதிரி 10 கிலோமீட்டர் 11 கிலோமீட்டர் போய்தான் கொண்டு போயிட்டு தான் அந்த போலியோ சொட்டு மருந்து போட்டுட்டு கொண்டு போய் வச்சுட்டு வரணும். ரொம்ப கஷ்டமா இருக்கு நடந்து போறது. இருந்தாலும் மக்களுக்காக ஒரு சேவை செய்யணுன்றதுக்காக இந்த ஒர்க்கை வந்து நான் கண்டினியூ பண்ணிட்டு இருக்கிறேன். எனக்கு எல்லாம் சப்போர்ட் பண்ணது சார் DMCHO மேம், DMO சாரு, பெருமாமலை பிஹெச்சி டாக்டர்ஸ், எஸ்பெஷல் கோவிட் வேக்சின் அப்போ வந்து 2-3 டைம் வந்து மீட்டிங் வச்சு போட மாட்டேன்னு சொன்னாங்க. எங்க நம்ம ஊர்கிட்ட கொரோனா வராதுல்ல, ஏன் நம்ம போடணும் அப்படின்லாம் சொல்லிட்டு இருந்தாங்க. இது போட்டு கட்டாயமா போட்டு ஆகணும், நம்ம சேஃப்டியை பார்த்துக்கணும் அப்படின்னு சொல்லி 4-5 தரமை நான் அவங்கள மீட்டிங் போட்டு பேசினேன். அப்புறம் ஒத்துக்கலை, திரும்பவும் பேசிட்டு அவர் 10 பேர் ஒத்துக்கிட்டாங்க. அவங்கள கூட்டிட்டு வந்து வட்டக்கானல், அதாவது 11 கிலோமீட்டர் நடந்து வந்து வட்டக்கானல் ஏரியாவில் வந்து விஹெச்என் சிஸ்டர்ஸ், எஸ்ஹெச்என் சிஸ்டர்ஸ், டாக்டர்ஸ் எல்லாமே சேர்ந்து அவங்களுக்கு ஊசியெல்லாம் போட்டுட்டு எல்லாம் அவேர்னஸ் கொடுத்தோம். அது கொடுத்த பிறகு அப்போ நல்லா இருக்காங்க அப்படின்னு தெரிஞ்சுக்கிட்டு தான் மக்கள் வந்து போடவே ஆரம்பிச்சாங்க. ஃபர்ஸ்ட் நீ போட்டியா, நீங்க போட்டீங்களா அப்படின்னு கூட கேட்டாங்க. என்னைய முதல்ல நான் இன்ஜெக்ஷன் பண்ணிட்டு தான் அடுத்தவங்களுக்கு நான் போய் சொல்ல ஆரம்பிச்சேன். அப்புறம் தான் கொஞ்சம் கொஞ்சமாகவும் அவங்கள மீட்டிங் போட்டு பேசி தான் போட வச்சிருக்கேன். கோவிட் வேக்சின்ல வந்து ரொம்ப கஷ்டப்பட்டேன். அதாவது டேப்லெட் எடுக்கிறதுக்குலாம் ரொம்ப கஷ்டம், பஸ் வசதி இல்லை இல்லையா. அதனால இங்க இருந்து வட்டக்கானல்ல இருந்து இங்க 10-11 கிலோமீட்டர் போயிட்டு வட்டக்கானல்ல இருந்து பஸ் இல்லாம நான் எப்படி போறது, அது 2000 ரூபாய் 3000 ரூபாய் கேக்குறாங்க பஸ் டிராவல் பண்ணிட்டு கொண்டு வந்துட்டு இருக்கு கார்ல. அது கொடுக்க முடியாம தான் ஒரு 1000 ரூபாய்க்கு தெரிஞ்சவங்களை வச்சுதான் நான் போயிட்டு வந்துட்டு டேப்லெட் எல்லாம் எடுத்துட்டு வந்து கொடுத்துட்டு இருந்திருக்கேன். அடுத்து பிள்ளைங்களோட 6 மந்த்ஸ்ல இருந்து பிள்ளைங்களுக்கு விட்டமின் ஏ, அல்பெண்டசோல் மாத்திரைகள், அப்புறம் விப்ஸ், நாப்கின் பாக்ஸ் நாங்க தலைச்சமையாத்தான் அந்த 11 கிலோமீட்டர்ல நடந்து தலைச்சமையாத்தான் சுமந்துட்டு வந்துட்டு பிள்ளைகளுக்கு கொடுக்குற மாதிரி இருந்துச்சு. ஒரு 22 பிள்ளைங்க இருக்காங்க, அவங்களுக்கெல்லாம் நாப்கின் கொடுத்துக்கிட்டு இருக்கிறேன். அப்புறம் ஸ்கூல் வேக்சின் போடணும், பிள்ளைகள் பூரா கூட்டிட்டு போய், அதாவது டாக்டர்ஸ் பிஎம்ஓ சாரு அவங்கெல்லாம் வந்து கேம்ப் போட்டு எல்லாம் இன்ஜெக்ஷன்லாம் பண்ணிட்டு கேம்ப் போட்டுட்டு டேப்லெட்லாம் கொடுத்துட்டு அவங்களுக்கும் நடந்து போறது கஷ்டம்தான், அவங்களும் நடந்து தான் ரொம்ப கஷ்டப்பட்டுக்கிட்டு இருக்காங்க. எங்களை மாதிரியே அவங்களும் கஷ்டம்தான் பட்டுக்கிட்டு இருக்காங்க. அதுவும் கோவிட் டைம்ல ரொம்ப ரொம்ப கஷ்டப்பட்டு, அதாவது சாப்பாட்டுக்கே ரொம்ப முடியாம இருந்துச்சு. அதாவது நாங்க வந்து பழங்கள்லாம் சேல்ஸ் பண்ணிட்டு அதை எடுத்துட்டு வந்து தான் நாங்க சாப்பிடணும். எடுத்துட்டு வந்து சேல்ஸ் பண்ணிட்டு எங்களுக்கு தேவையான பொருட்களை வந்து தான் நாங்க வாங்கி சாப்பிட முடியும். ஆனா அந்த டைம்ல வந்து எது கடைகள்லாம் அடைச்சிருக்கும் இல்லையா, அதனால வாங்க முடியாதனால எங்களுக்கு வியோம சார் வந்து ஒரு ஹோட்டல் மூலியமா, தமரா ஹோட்டல் மூலியமா எங்களுக்கு வந்து ஒரு உதவி செஞ்சாரு. அதாவது குடும்பத்துக்கு தேவையான பொருட்கள், இனிய அரிசி, பருப்பு, அதாவது குளிக்கிற சோப்பு, துவைக்கிற சோப்பு, அது முதற்கொண்டு எல்லாமே அவங்க வந்து எங்களுக்கு வந்து வாங்கி கொடுத்தாங்க எங்க மெடிக்கல் டிபார்ட்மெண்ட். அவருக்கு நன்றி. பிஎம்ஓ சார், சந்தோஷ் சார், ஸ்ரீதர் சார் வந்து அவங்க வந்து டேப்லெட்லாம் கொரோனா டயத்துல வந்து டேப்லெட்லாம் நிறைய கொடுத்தாங்க, உதவி பண்ணாங்க. அப்புறம் ரேஷன் வாங்குறதுக்காக நாங்கள் போவோம், அப்போ கேம்ப் போட்டுருவோம். நாங்கள் கேம்ப் போட்டு இந்த கொரோனா வேக்சினை பற்றி எல்லாம் சொல்லித்தான் ஒரு கவர் பண்ணி தான் நாங்கள் வேக்சினே போட்டோம். ரொம்ப முடியாமல் நடந்து வர முடியாத கஷ்டம், இதுலேயுமே நான் மக்களுக்கு சேவை செய்யணுன்றது ஒரே குறிக்கோள் தான் நான் இருக்கேன். இதே மாதிரி நான் கஷ்டப்படுற மாதிரி ஒவ்வொரு ஆஷாவும் கஷ்டப்பட்டுட்டு தான் இருக்காங்க. அங்கங்க ஏரியாவில் இருக்காங்க, கஷ்டப்பட்டு நடந்து வந்து தான் வேலை பார்த்துக்கிட்டு இருக்கோம். இந்த வேலை வந்து எங்களுக்கு அரசாங்கம் மூலம் பணி நிரந்தரம் செய்யுமாறு மிக தாழ்மையோட கேட்டுக்கொள்கிறேன் மேம்.
Thank you so much.
Thank you very much, ma'am. It's a very happy, ma'am.
We are also very happy. And
Yeah,
your
yes,
emotions are coming out so clearly on your face, and we also got to read the translation. Thank you.
Thank you very much, ma'am.
Thanks. I would now like to invite Dr. Olinda Timms to announce the next award to Nazma.
Thank you, Amita. I'm honored to read out the citation for Miss Nazma. The citation is an award of appreciation in category 2, nursing professionals and counselors. Miss Nazma is from Delhi and completed her general nursing from Jamia Hamdard University in 2014. She served as a nurse at the Hakim Abdul Hamid Centenary Hospital, New Delhi, and is currently on a break from her nursing career and working for her community. When COVID-19 reached India, Nurse Nazma was pregnant. She decided to continue to work and carry out her responsibilities. She served in an intensive care unit at the hospital during the pandemic. She visited local communities and raised their awareness of COVID-19. When she realized that others around her were afraid of getting vaccinated, she chose to visit every household in her community and made them aware of the importance of vaccination and was able to get half the people vaccinated. She participated in a number of campaigns, including the Right to Food campaign during the pandemic, and reached out to other communities as well, creating awareness about COVID-19 appropriate behavior. She made efforts to convince and counsel parents to get their children vaccinated and help them to do so. She started a free sample collection with her husband's help. Inspired by the couple's spirit of service, some others came forward to extend their support. As host of the FMES IJME Ethics Award 2021, we are pleased and proud to honor Ms. Nazma with an award of appreciation in category 2, nursing professionals and counselors, for her outstanding contribution to ethical practices and improving access to healthcare for the marginalized during the COVID-19 pandemic.
Thank you. Let us give a big hand to Nazma Appa. नज़मा, हम आपसे सुनना चाहेंगे. Right. Your story.
Good evening, all of you. First of all, I would like to say thanks to all of you that you have given me such a big opportunity. I don't have words. I can't explain my feelings with how much happy that you people have given such opportunity, and this is a big day for me. I'm really so happy. I want to introduce myself my name has been already announced. My name is Nazma. Naz is my nickname. I have worked in Jamia Hamdard University, HASC hospital. This is Majidia Hospital, situated in Jamia Hamdard University. I have worked there, and in pandemic time, I was pregnant. Full-time pregnancy, 9 months pregnancy में मैंने COVID-19 positive patient के साथ काम किया. And they people told me कि I can change my ward. I can give my services to general patient है. But मैंने ऐसा नहीं किया. मैंने COVID-19 positive patient के साथ बिना डरते हुए काम किया. और जब मुझे एहसास हुआ कि मैं अपना पूरा टाइम कम्युनिटी को नहीं दे पा रही हूँ, देन आई लेफ्ट द जॉब और मेरे हस्बैंड ने और मिलकर कम्युनिटी को अपना टाइम देना शुरू किया. In that time, my husband and me started a lab जिसमें हमने free of cost lab services लोगों को दी और वैक्सीन के लिए लोगों को हमने बहुत मोटिवेट किया. लोग बहुत स्कैर्ड थे, कुछ लोगों की सोच थी कि इनफर्टिलिटी हो जाएगी इससे वगैरह वगैरह, उनको हमने समझाया और वैक्सीन बूथ तक ले जाना बहुत ही चैलेंजिंग वर्क था, बट हमने कंटिन्यू किया. पेंडेमिक टाइम में जो प्रेग्नेंट लेडीज थी वो अपना चेकअप कराने से स्कैर्ड थी और उनको वो फैसिलिटीज भी मिल नहीं पा रही थी. वो सब मैंने और मेरे हस्बैंड ने कंटिन्यू इस तरफ काम किया है. एंड अपार्ट फ्रॉम दैट मैं बच्चों को वैक्सीन के लिए बहुत ज़्यादा मोटिवेट करती हूँ, बिकॉज जो बच्चे हैं वही हमारे भारत का फ्यूचर है. तो लोग अभी भी वैक्सीनेट कराने से डरते हैं अपने बच्चों को. उसके लिए मैं लोगों को बहुत मोटिवेट करती हूँ फ्रॉम माय होम एंड आई एम गिविंग माय फुल टाइम टू कम्युनिटी एंड this is one of the most important thing that this facility is free of cost. I really thank you to give me such big opportunity.
थैंक यू नज़मा जी, बहुत अच्छा लगा हमें आपका आपकी तरफ से सुन के, और अब हमारी तरफ से आपको एक बड़ा थैंक यू फिर से.
Thank you, ma'am. Really thank you.
Thank you. Now I will again invite Mala to announce the next award for the COVID warriors.
My pleasure to read the citation for the COVID Warriors Award for Appreciation in Category 3, Citizens Groups formed during the pandemic. The group COVID Warriors was formed in Bangalore, Karnataka to respond to some of the pressing needs on the ground. Persons from across diverse professions, faiths, old and young, joined the group as volunteers motivated by the devastation witnessed during the pandemic. They all joined hands to serve and provide relief. It was remarkable that the volunteers included teachers, pilots, students, doctors, bankers, and senior officers in Bangalore-based corporate offices. As part of COVID-19 relief work, the group focused on an area few would consider taking on, that is the burial of persons who had lost the battle with COVID-19. The members of the COVID Warriors provided the deceased a dignified burial free of cost and often stood in for families, as in many cases there were no family members or they were overwhelmed with the fear of catching the fatal virus. In some cases, the volunteers helped to pack the bodies in the hospitals. Members of the COVID Warriors offered prayers and completed the rituals in accordance with their faiths. This has been an exceptional effort to provide dignity to the dead. They also invested their energies in creating a pool of resources to be able to support poorer families and some marginalized communities. These included distribution of groceries and provision to people in deprived areas, old people's homes, and to the transgender community. They also collected funds for Sandesh, an NGO working with children living with disabilities. These efforts were critical in securing essential medical supplies and food packets for these children during the pandemic. Members of the group also helped COVID-19 patients to obtain hospital beds, oxygen cylinders, or an ambulance. Needless to mention, the path was treacherous. They faced many challenges, such as ensuring the safe movement of volunteers in the city during strict lockdown and stringent police vigilance. They also risked their own safety and lives in a situation of shortage of safety equipment like gloves and personal protection equipment. The nature of their work and its volume and maintaining the pace of relief work in the thick of the pandemic, serving people who were most vulnerable, was physically and mentally exhausting. They were unable to rest even between burials. During the COVID-19 pandemic, donors generally offered support to those in need whenever necessary. Some volunteers of the group received free vaccinations from doctors and other individuals, provided snacks for them while they worked to promote health in the community. One of the biggest motivators for this group was the unselfish attitude of the young who were willing to serve tirelessly for the unknown victims and their families. We are delighted to honor the COVID warriors with an award of appreciation under the FMES IJME Ethics Award 2020-21 in category 3, citizens groups formed during the pandemic for their outstanding contribution to ethical practices and improving access to healthcare for the marginalized during COVID-19 pandemic.
Thank you so much. Let's give them a big hand. Everybody use your clap functions. Thank you so much. Yes, we would also like to now hear from the COVID warriors about their experience and what are their stories.
No one here right now.
No?
Yes.
We don't have anyone from the COVID warriors?
Yes, yes.
Okay. This is, it is unfortunate that nobody from their end could join us, because I'm sure their stories also would have been very interesting to hear and also sometimes very difficult, but still it is a celebration today of all the hard work that all our awardees have done. So I think I'll open the floor now, and we can, all of you who have some questions, clarifications or comments, can please write in the chat box as well as raise your hand, and I will call out to you, those who have raised your hand, or take it from the chat box. And please do tell if you have a specific question for anybody, or if it's a general one, then I will request one of the awardees to take it. Do raise your hands if anybody wants to make a comment. We have about 5 to 7 minutes. We can take some comments or some questions. Does anyone from the FMES family want to make a comment?
Probably from those who did not have opportunity to say anything. So we spoke, so maybe some others.
I think Meera Shiva is there. Please ask her to speak.
Yes, thanks, Amar. Meera, would you like to share your thoughts, please? Meera Shiva, Dr. Meera Shiva.
Yeah. No, actually, I joined you all to listen because anyone working during the COVID time, selflessly, when so many people were feeling depressed and many children from privileged home wanting to watch Netflix and order food. And here are these young people working, the Asha, the Asha person, I'm forgetting her name, in the difficult situation. Very, very impressive, very educative, very inspiring, and I'm so glad that I managed to, I'm sitting here and looking at the paper, so many new things, new laws, news, etc. coming, some of which is very depressing. So hearing this inspiring and positive stories increases your emotional hemoglobin. So I wanted to thank all the awardees, and I wanted to thank FMES and IGME for thinking of this and recognizing the right people. Solidarity deep, deep solidarity and deep, deep appreciation and more strength to everyone who's doing. Don't get tired. Your work will be needed more and more in the coming time. My lots of love from my side.
Thank you, Meera, for those very sweet words. Anybody else who would like to share, comment? Amar, would you like to say something?
Veena is there, Veena Vaswani. Why don't you? Because she is one of the person
yes,
who is involved in ethics for such a long time, and it would be good if she speaks something.
Yes.
Thank you very much.
Yes,
and
please
this
go
is
ahead.
quite an inspirational moment for all of us. We can take a lot of inspiration, and they have proved today, people with mettle, that when going gets tough, the tough get going. It's not required to have a huge number of degrees or be paid good or something. Starting from Amar itself and a whole lot of them, lot of these people have just shown strength and determination all the way. I wish we can emulate some from them also. And thank you for giving me the opportunity. And it's also lovely that FMES, IJME didn't give up because things were getting tough on them, but somehow they made sure that this went through Olinda's dreams and everybody's commitment. So I really think that the show must go on. And thank you very much for the opportunity.
Thank you, Veena. We also have Dr. Sanjay Pai. Would you like to say something?
Yeah. Can you guys see me?
No, we can't.
No.
Yeah, that's not surprising. I forgot to switch on the video. Okay, I just want to say that Monday afternoon is a very, very tough time because I'm very busy in the hospital and I decided not to attend this. And I'm glad. I would have been really stupid to have missed this thing. I decided because Ria told me in the morning, I think you should attend this meeting. And so I logged in at about 4:10. I'm absolutely dumbfounded by these people. They are so inspiring, as somebody else before. I'm sure everybody else is thinking of the same thing. All of us think that we are doing fairly good work. And I think we're doing fairly good work, but it pales into insignificance compared to the kind of dedication and determination that all of these awardees have shown. I have learned a lot over the past 1.5 hours. And yes, indeed, over the past 1.5 years. That was a Freudian slip. Anyway, I've learned a lot over the last 1.5 hours, and I hope that I can, in some small way, repeat the kind of work that all of these people have done over the last 1.5 years. Incredible. It's really great to be part of this community and to know that we have such people amongst us who can, show us light, so to say. That's all I have to say.
Thank you so much, Sanjay. Yes, inspiring is the word, and that's what it entirely echoes and resonates with me. Anyone else who would like to share some thoughts?
Amar.
Yes, Amar, by popular choice.
Well, everybody has said so much. I just echo what they have said. I think in India we have entered in an age where the solidarity and empathy, these are the two major virtues of being human, are getting lost. And sometimes you feel so depressed that a large number of people are moving away from that. I think that is one of the reasons why the concern for human rights and ethics have declined in India. In the midst of that, despite such great odds, when you know that there are people who are coming forward and standing up and being counted, that while the evil has become banal, everywhere is there is also some heroism also which is becoming banal, where people are taking stand and even at the great risk of their health and lives, they are contributing something to change the society. So I'm really, really very happy that there are so many people, and perhaps I'm sure we must have missed many, many others because who did not get nominated and so we could not discuss about them. But there are many other unsung heroes around and heroines around, which we don't know. And hopefully in coming time, more and more such stories will be documented. And I hope in the Indian Journal of Medical Ethics, we are able to publish all these stories one after another, so that they don't get lost to the posterity, and they keep inspiring coming generation of the people. So thank you very much.
Thank you, Amar. Yes. Mala?
Amita?
Yes.
Is it okay if I say something in Tamil?
Sure. Yes, please.
கோகிலா அக்கா, வாசவதி அக்கா, மக்களுக்கிடையே போய் அவங்களுக்கு ஒரு துணையா நின்று அவங்களுக்கு சேவை செய்யணும்ன்ற ஒரே குறிக்கோளோட தன்னலம் இல்லாத சேவை செய்யறது, அதுவும் இந்த மாதிரி கஷ்டமான நேரத்துல மனசுல ரொம்ப உறுதி வேணும். அந்த உறுதிக்கு உங்களை போல எடுத்துக்காட்டு எங்கேயுமே கிடைக்க வாய்ப்பே இல்லை. அந்த உறுதியும் மனித நேயத்தையும் எங்களுக்கு காட்டி கொடுத்ததுக்கு ரொம்ப நன்றி. மனுஷங்க ஒருத்தவங்களும் உங்களுக்கு நன்றி சொல்லலைன்னா கூட நாங்களாவது எழுந்து நின்று எல்லார் சார்பிலையும் உங்களுக்கு நன்றி சொல்ல கடமைப்பட்டிருக்கோம். அதுதான் எங்களால முடிஞ்ச இந்த சின்ன அவார்டு. இது ஒரு பெரிய விஷயம் இல்லை. எங்களால செய்ய முடிஞ்சது இந்த அவார்டு ஒண்ணுதான். நீங்க செஞ்சது அதை விட கோடி போறோம். அதுக்காக நன்றி சொல்றேன். என் சார்பிலையும் சரி, இங்க இருக்கிற எல்லார் சார்பிலையும் சரி, உங்க சேவையை எதிர்கொண்டு நிக்கிற மக்கள் சார்பிலையும், அவங்க ஒருத்தர் சார்பிலையும் உங்களுக்கு நன்றி சொல்றேன். நன்றி அம்மா, ரொம்ப நன்றி.
Thank you so much, Mala, for that, because in a multilingual country like ours, we always feel that we need to do more to reach out across the different languages. So thank you for that. And before Mala spoke, Dr. Amar Jasani, who is the editor of Indian Journal of Medical Ethics, and he's been in public health and in developing bioethics discourse for a long time in India, one of the pioneers. And now I'm going to invite Dr. Sanjay Nagral, who is the publisher of the Indian Journal of Medical Ethics and has been associated with both the medical ethics movement as well as the Jan Swasthya Abhiyan, the health movement in India. And Dr. Sanjay Nagral is also a surgeon specialized in liver and pancreatic surgery. He was involved in the first liver transplant that happened in India. He heads the Department of General Surgery at the KB Bhabha Municipal General Hospital, and he's also the coordinator of the Department of Gastroenterology, Surgical Gastroenterology at Jaslok Hospital. And he's the Joint Secretary of the Zonal Transplant Coordination Committee based in Mumbai. What is important is that they regulate cadaveric transplant activity, which is something that is so important for India, but not happening enough. But more than that, Dr. Nagral writes prolifically on issues of health and ethics. So I invite Sanjay to give closing remarks for this wonderful evening, very inspiring and very humbling. Over to you, Sanjay.
Thank you, Amita. Can you all hear me?
Yes, Sanjay.
Yeah, thank you, Meera. And so first of all, just remind me that next time I need to send you send the FMES updated CV, because that CV was a little outdated. But anyways, so I'm not going to give you a long speech because this was about the awardees. But I can't resist the temptation of saying that as somebody who worked during COVID, perhaps a little in a urban sort of tertiary setup of surgery. I think COVID exposed many things about healthcare, and especially about Indian healthcare, and all of us know that. But I think it did some good, and amongst the good things that it brought up was, number one, I think the spotlight zoomed in a little, even if temporarily, on those who actually work in healthcare. Because there's an impression that healthcare is run by sort of imposing looking doctors. So COVID, that was completely demolished. And I hope, and I think people realize that healthcare and is delivered by a large army of individuals. And in that sense, I think these awards therefore continue that aspect of COVID. COVID also did one more thing, which is remarkable, and which is that it brought up these spontaneous groups of individuals who got together. And we had two such groups who were honored today. And I think this was also, whilst we have the voluntary sector in India in healthcare for many years, but I think COVID particularly brought together people like never before. And one hopes that that experience also is sustained. And I think it is great that IJME, FMAS decided to honor and recognize some of these groups. I also have been told to give a vote of thanks. Now, that is one of the most boring and most cliched of ideas in meetings. You know, I don't know who has called it the vote of thanks, whatever that means. But don't worry, I'm not going to give you a long list, which often ends with including in a meeting, it includes the person who has helped with the stage, and but here I don't have to thank Zoom. But I thought there was a slide coming up of the individuals and people who are okay. So obviously we are very grateful to this list of groups and individuals. Elsevier, of course, and I think Olinda. This must be the fourth or fifth time people are thanking her because it was very much due to her initiative. Yenepoya, whom now we think are actually our permanent partners, seems like. So thank you, Veena. I am particularly curious about, and it's a special thanks to the selection committee, and I'm curious about how some of these awardees were chosen. Because obviously a lot of effort has gone into identifying some of them. These are not people who are usually in the sort of front pages of newspapers. So most awards, by the way, in India are very incestuous, as you know. So awards are usually given by people to each other who know each other. So this is quite remarkable to see individuals who I think have been there's been an effort in identifying these individuals. And I think that's particularly great about today's awards and listening to some of them today. And I'm sure this was due to a lot of, again, NGOs, people working on the ground who have nominated them. And then, of course, there is people who have worked with the behind the scenes on the award, the IJME editorial team, and Riya Meenakshi, the Ethics Award Secretariat, Sharanya, Mahendra, and Vijay, and all colleagues across all the platforms who are associated with us, and Arya from DTP. But I think whilst all these people have been important, there is one indefatigable person who works behind the scenes in most of FMAS IJME activities, and that indefatigable person is, although she fatigues you when she sends you a long email, is Sunita Bandewar. So we must also, although she's the host, but I must take the opportunity to thank, because her persistence and sort of continuous effort drives many of the activities that we do. So Amita, I think I'll hand it back to you. By the way, I learned 2 or 3 things today, interesting things, thanks to. So Amita, I learned that you can clap in in a Zoom meeting. I didn't know that. So thank you for that.
Yes, because how do we extend our appreciation and make people
Yes, of
feel
course,
this is a real thing?
I
Thank you.
really didn't know that it had that you
Yes.
can sort of have the clapping. I used to always wonder what is that clapping sign. So okay, great.
And you have some incentive to send us your updated CV now.
Yes.
Okay.
Of course.
Thanks so
And,
much. And I have to join Sanjay in saying a big thank you to Sunita Bandewar, who has really been the backbone of making this event happen and keeping everybody, motivated for this event to take place. So thank you for bringing that up. And with that, I announce that we are at the end of this event. Thank you everybody for being with us, and thanks to all the awardees for that great amount of work, which, like I said before, was humbling for us, and very happy that we could identify and actually reach the award to you. Thanks so much.
yeah, this must be some kind of a record. We are finishing 2 minutes before time, I think 3 minutes before time. So I think great, wonderful. Thank you everyone.
Thanks so much.
Thank you, everyone.
Okay, bye-bye.
Bye.
Bye, ma'am.
Bye-bye. Take care.
Bye. Bye, everybody. Thank
Thank
you.
you. Thank you so much. Wonderful function.
Thank you, ma'am.
Thank you so much.
Thank you. Thank you, ma'am. Thank you, ma'am.
Thank you, ma'am.
Thank you, ma. Thank you, ma.
Okay, bye-bye. Take care. All the
Sunita,
best,
bye-bye.
everyone, and stay safe. Bye-bye.
Bye. चलो FPNC को टेंशन होती है